Welcome to today's radiology lecture. We will explore medical imaging and interpretation. It's important for future physicians to understand analyzing images. We'll cover X-ray interpretation, chest and abdominal X-ray evaluation, and musculoskeletal radiography. By the end, you'll have a comprehensive understanding of different imaging modalities. Let's begin. X-ray imaging is one of the most commonly used modalities in diagnostic radiology. Understanding X-ray image interpretation is essential for detecting and diagnosing a wide array of medical conditions. When interpreting an X-ray, several key factors need to be considered. First, we evaluate image quality factors such as exposure, positioning, and instrument calibration. Then, we carefully assess anatomical structures, looking for any abnormalities or pathology that might be present. Pathologies can include fractures, tumors, calcifications, and signs of infection. Familiarity with radiographic anatomy and detailed knowledge of normal variations are crucial for accurate interpretation. In the chest X-ray interpretation section, we analyze the lungs, heart, mediastinum, diaphragm, and bony structures. We look for signs of pneumonia, tumors, cardiomegaly, heart failure, valvular abnormalities, mediastinal widening, lymphadenopathy, masses, fractures, and bone diseases. Abdominal X-ray examinations aid in diagnosing gastrointestinal, genitourinary, and abdominal wall abnormalities. When interpreting an abdominal X-ray, we assess the gas pattern in different abdominal organs, look for any signs of bowel obstruction, and assess the presence of free air, which may indicate perforation. Specific anatomical landmarks are examined, including the liver, spleen, kidneys, and bony structures such as the vertebrae and pelvis. Understanding normal radiographic anatomy allows us to identify potential abnormalities, including organomegaly, renal calculi, bowel dilatation, or the presence of foreign bodies. Musculoskeletal X-ray examinations are crucial for diagnosing bone and joint-related conditions. When interpreting musculoskeletal X-rays, we utilize a systematic approach. We examine both bones and joints, assessing for fractures, dislocation, joint space narrowing, osteophytes, or erosive changes indicative of arthritis. The radiographic appearance of normal ossification centers in pediatric patients differs from adults, necessitating additional considerations when evaluating pediatric musculoskeletal films. Identification of normal variants, such as sesamoid bones and accessory ossicles, is essential to avoid misinterpretation as pathology. Radiographic imaging plays a pivotal role in diagnosing traumatic injuries. We look for specific radiographic signs characteristic of trauma, such as displaced fractures, joint dislocations, subluxations, or signs of hematoma. Understanding trauma patterns helps identify potential injury locations and guides appropriate surgical planning. We also consider the mechanism of injury and correlate radiographic findings with clinical history to ensure accurate diagnosis and appropriate patient management. Pediatric X-ray interpretation demands particular attention, as imaging findings can significantly differ from those observed in adults. Knowledge of normal growth and ossification patterns is crucial to avoid overdiagnosis or misinterpretation of normal variants as pathology. Pediatric chest X-rays might reveal congenital abnormalities, lung malformations, or signs of pediatric respiratory syndromes. Musculoskeletal imaging in children often focuses on growth plate injuries, epiphyseal separations, and other pediatric-specific abnormalities. Mastery of pediatric X-ray interpretation enhances clinical decision-making and pediatric patient care. Contrast studies and fluoroscopy offer dynamic visualization of various anatomical systems. Interpretation of contrast-enhanced imaging involves recognizing normal and abnormal contrast distribution and identifying any anatomical or functional abnormalities. In gastrointestinal studies, we assess for strictures, obstructions, diverticula, and motility disorders. Fluoroscopic evaluation of the genitourinary system aids in identifying ureteral strictures, vesicoureteral reflux, or anatomical anomalies. Additionally, fluoroscopy assists in guiding interventional procedures such as barium swallow studies, angiography, or percutaneous drain insertions. Neuroimaging helps diagnose and monitor various neurological conditions. When interpreting neuroimaging studies, we evaluate different modalities, including computed tomography, CT, and magnetic resonance imaging, MRI. Specific imaging protocols are used to assess different anatomical structures, such as the brain, spinal cord, and associated vasculature. Identification of neuroanatomical landmarks allows for localization of potential lesions, such as tumors, hemorrhages, or ischemic infarctions. Understanding the basic principles of neuroimaging aids in providing specialized care for neurologic patients. Interventional radiology combines image-guided procedures and diagnostic imaging interpretation. We examine various interventional procedures, including angiography, embolization, biopsy, and catheter placements. Interpretation of interventional radiology images involves understanding different catheter placements, embolization devices, and their appearances on radiographic images. Accurate identification of complications, such as vessel perforation, thrombosis, or migration of embolization devices, is vital for prompt intervention and patient safety. Thoracic imaging encompasses various modalities such as CT, MRI, and positron emission tomography, PET. Interpretation of thoracic imaging studies involves assessing the lungs, mediastinum, pleura, and thoracic vasculature. Pulmonary nodules, masses, consolidations, and ground glass opacities are analyzed for their appearance, size, and distribution. The mediastinal structures are assessed for lymphadenopathy, tumors, or signs of invasion. Lung cancer staging and monitoring response to treatment are significant aspects of thoracic imaging interpretation. Advanced cardiac imaging techniques, including cardiac CT and cardiac MRI, play a vital role in assessing and diagnosing cardiovascular diseases. Interpretation of cardiac imaging studies involves evaluating cardiac anatomy, function, and blood flow. We assess for coronary artery disease, myocardial infarctions, valvular abnormalities, and congenital heart diseases. Detailed interpretation of cardiac imaging aids in accurate diagnosis, surgical planning, and monitoring response to treatment in cardiovascular patients. Nuclear medicine and molecular imaging techniques provide functional information at the molecular level. Interpretation of nuclear medicine studies involves understanding radiopharmaceuticals and their distribution patterns. We assess for functional abnormalities, such as tumor uptake, perfusion defects, or metabolic alterations. Nuclear medicine imaging aids in diagnosing and staging cancers, evaluating thyroid disorders, and assessing bone metabolism. Fluorodeoxyglucose positron emission tomography, FDG PET, is particularly useful in oncology, identifying metastatic disease and monitoring treatment response. In conclusion, mastering medical image interpretation is vital for physicians. We covered X-ray image interpretation, advanced cardiac imaging, and nuclear medicine in this lecture, highlighting their unique applications and challenges. Expertise in radiology improves patient care and aids in making accurate diagnoses and treatment decisions. Thank you for your attention, and I hope you found this lecture informative and valuable.